We're here today with one of our sleep patients. Dawn, thanks for coming.
My pleasure.
Appreciate being here.
Absolutely.
Just wanted you to kind of get the feel for what our patients go through and the experiences they've had with us as a dental office specializing in dental sleep medicine. Dawn was a current, or was a former CPAP user, now is a current oral appliance user. Dawn has severe sleep apnea. Your initial AHI, Dawn, was 87, if you remember.
I do.
And actually Will at the sleep lab, who you met watching the videotape of me having my overnight sleep study, recommended that Dawn talk to us about the potential of oral appliance therapy. And as we said before in the program, 87, that's pretty severe. And to treat that with oral appliance therapy, you have to, number one, have a very compliant patient, as Dawn has been, and a very understanding patient, as Dawn has been. But Dawn was really, really motivated to try and get away from the CPAP. So we got him into a SomnoDent oral appliance, and it's been about 4 months now, hasn't it, Dawn, I think?
Yes.
Somewhere around there. I don't know.
5, actually.
5 months. And so I thought I'd let you just hear Dawn's experience with the oral appliance, how he feels. He did go back for a follow-up sleep study, as I mentioned before. That is the AADSM's protocol, that once you have gotten the patient titrated to the maximum efficacy of the oral appliance, they need to go back to their sleep physician for a follow-up PSG. And Dawn has completed that protocol. And we're going to turn the camera over to Dawn. And Dawn, just kind of tell the folks what it was like to be on a CPAP first.
Well, I had a really tough time with the CPAP machine. It was a constant rotation of chest infections. I was constantly coughing up mucus and so forth from the use of this machine, and I slept pretty good with it after I made that initial horrible adjustment to it, but it was just a constant rotation of chest colds, and I attribute it to the CPAP machine and the forced air going down into my lungs all the time. Whether that's right or wrong, I don't know, but Will from the Hammett Sleep Lab, like Dr. Tucker said, got in touch with me, and he thought I was a good candidate for a dental appliance. I was very excited about the program when I heard about what was involved and how it works, and Dr. Tucker and myself worked through it, and I'm not overemphasizing the fact to tell you that it changed my life. Is fact. It definitely has. There's no more, I go on trips, I don't have to lug the CPAP machine. I take a little box with the appliance in it, and it works great. I feel good, I sleep good, and it literally has changed my life.
Awesome, that's awesome. Dawn, what got you motivated at first to go even have a sleep study? I mean, was your wife elbowing you in the night because you snored, or were you just tired? What motivated you to even investigate this whole issue of obstructive sleep apnea?
Almost all of the above. I was, I didn't know how bad it was, but I was making noises at night. I'm moaning and groaning. She says I'm snoring like crazy, and I'm stopping breathing, and finally, it just so happens my wife's a registered nurse. She said, that's enough. We're setting you up for a sleep apnea study. And boy, I had it. I had it big time.
And did you feel better when you were on the CPAP, though, Dawn? Could you notice an improvement in your overall well-being and tiredness throughout the day?
Yes, I did. It did help. It just it's a hard device to listen to while I'm. It was a tremendous adjustment for me. The noise, the mask, the cumbersome thing, like I said, when you're traveling, and the dental appliance does the same thing, and you can put it in your pocket.
Yeah,
that was big to me.
You're an outdoorsman. You're an avid outdoorsman, avid hunter and fisherman. So obviously, the fact that you don't have to take the CPAP with you. I know you're headed out here tomorrow to actually do some bear hunting.
Yep.
So your buddies probably are going to be excited that you aren't going to be snoring and bringing down the camp house. And the oral appliance, you throw it in your pocket and you're good to go. Compare with us how you feel after sleeping with the oral appliance as compared to sleeping with the CPAP. Can you kind of give us, do you feel about the same? Do you feel better? How would you compare the two?
Well, at first it was very similar, but now that I'm adjusting to the dental appliance more, I think I think I'm probably feeling better and sleeping better than I was with the CPAP, because I'm just adjusted to it, and it's so simple. It's so nice, you know. You can lay on your stomach, your side. You don't have to worry about, you know, the mask falling off at night. And
that's awesome.
Again, I'm not overstating it when I tell you it's changed my life.
Awesome. Dawn, you know, we have to go through all the different possible side effects with patients with oral appliance therapy, and you know, we went through all that with you. When you wake up in the morning, and you know, we talked about your bite can be off and jaw tenderness. How have you been doing with that? Can you comment on that some?
Yeah, it's a slight adjustment. Again, in my book, it's well worth the adjustment period that you go through, which is very short. When you wake up in the morning, your jaw feels off. It feels like it's out of alignment slightly, but Dr. Tucker gave me a little device that I can put in my mouth very quickly, and usually within 10 minutes you're back to normal and good to go for the day.
Awesome. So Dawn, would you recommend this therapy for somebody else that is on CPAP?
Absolutely, absolutely. I think if you can bring yourself to make the adjustment, it's very well worth it to anyone.
Awesome. So there is a non-scripted, Dawn was a little bit nervous about coming in tonight and said, John, you know, what do I have to say? And I said, speak it from his heart. And Dawn, you certainly did speak it from your heart, and I thank you for that. So this is typically what you're going to hear from your dental sleep patients, and you can see that we've had a profound effect with oral appliance therapy. So Dawn, once again, thank you, and I wish you well on your hunt, buddy.
Thank you.
All right.